If you were the doctor, how would you handle this situation? A 14-year-old girl comes to you asking for termination of a pregnancy. What are the issues? Now, I appreciate this is a sensitive topic, but guess what? You might be asked about sensitive topics in your medical school interview, so you need to be able to know how to handle them. Let's go. So first and foremost, you need to determine if the girl is Fraser competent or not. Okay, what is Fraser competent? So the Fraser guidelines are a set of guidelines that say if the person knows and understands the complications after abortion, they understand the effects and side effects of abortion, and they know about contraception, then you can essentially withhold parental consent. You don't need parental consent, and you don't need to involve the parents. However, if they're not Fraser competent, then you do. So essentially, they need to have capacity, they need to be intellectual, they need to be able to understand what you're saying, okay? Essentially, they don't need to be Einstein, but they need to have the capacity to understand, retain, and communicate information back to you. URC, remember it that way. Okay, what else? You need to determine the age of the fetus. If the fetus is 24 weeks or older, then abortion is a no-go, okay? Even if it's close to 24 weeks, most surgeons will be hesitant to do the surgery. Okay? What else? You need to deliver holistic care. Holistic care is a comprehensive approach to healthcare in which you don't just treat their patient as an alienated individual, you try and put yourself in their shoes, okay? So you're going to try and understand, how old's the father? Okay? If the father's 14, then you don't need to involve the police. However, if the father's 21, then you do. Okay, you then also need to understand, has she been abused? Has she been raped? Because that will dictate whether you involve social services or not, alongside the police, of course. Okay, what if abortion goes against your religious beliefs? How do I tackle this question? Okay, so you can refer the case on to another doctor, that's fine, because you don't have to go against your beliefs. However, that doesn't withhold you from your duty to deliver the utmost highest standard of care to this patient, okay? So you can say something along the lines of this: if you have any concerns, you can voice them over to me, and I will tell them to the other doctor, but I'm going to refer your case to this other doctor, and he will handle you. Okay, so that is something that you can do to be able to tackle that situation. Now, I've told you how you can tackle it from all angles. Alongside this, you need to make sure that, okay, analyze the situation. The girl's 14, so it's likely that she needs a lot of emotional support, okay? Now, some 14-year-olds are more mature than others, but because she's 14, okay, let's be honest, it's highly likely that she'll need a lot of emotional support. So you need to be empathetic, understanding, and considerate and compassionate. The manifestation of all the good qualities of good medical practice, okay? All the GMC guidelines of medical practice. So that, ladies and gentlemen, is how you answer this question. Thank you for watching.